Sickle cell disease is the most common genetically transmitted disorder in the United States, and 1 in 400 infants of African ancestry are born infected. The World Health Organization estimates that roughly 5% of the world's population are healthy carriers of a gene for sickle cell disease, and that the percentage of people who are carriers is as high as 25% in some regions. Living with sickle cell disease is often characterized by frequent blood transfusions and chronic pain, but the care and treatment of those who suffer from the illness is advancing. There are 12 National Institutes of Health-funded sickle cell disease research centers in the United States, and Children's Hospital Los Angeles is one of them. Joining us now to discuss what's new in the battle against this chronic blood disorder is pediatric hematologist Dr. Thomas Hofstra. Welcome to Full Frame.
Oh, no, thank you for having me.
First and foremost, for people who aren't familiar with it, describe it for us, because I've heard it described kind of, you have donut-shaped blood cells, sickle cells, more like a sickle. Talk to me about this disease.
Yeah, so what sickle cell disease is it's an inherited condition, and it's called a recessive condition, which means that both the mother and the father have to be carriers, and there's a 1 in 4 chance that any child they have will be affected. And it affects what makes our blood red, called hemoglobin. And normal red blood cells can slide through small blood vessels, but what happens with sickle cell disease is because this hemoglobin is abnormal, it forms those sickles, or those crescent-shaped red blood cells, as you talked about, and they become very sticky, and they block blood vessels, sort of like a log jam on a river, and then the blood can't go beyond that, and then tissues get damaged because they don't get oxygen, there's inflammation, and all kinds of problems can happen as a result of that.
So you see virtually all kids, and kids going through a lot of troubling times. I mean, talk to us about these pain crises, because they're enormous.
Sure. Pain in sickle cell disease, pain crisis is the most common problem that happens with sickle cell disease, and that's when there's enough blockage of those small blood vessels that injury occurs. And have you ever broken a bone, Mike?
Sure, yeah.
So I've never broken a bone, but intellectually I've heard everybody say it hurts a lot. And we had a kid with sickle cell disease, 3 years old, came to the hospital 2 days after breaking her arm because their parents said she's not nearly as fussy as she is when she's having pain from her sickle cell disease. So intellectually I said, that's pretty bad. But you ever hit your finger in a car door?
Yep.
Yeah, I can tell you the exact day and time it happened. I was in the 10th grade. And one of my kids with sickle cell disease, one of my teenagers, came to my clinic and his finger was bandaged. I said, Brandon, what happened? And he said, Dr. Hofstra, I smashed my finger in a car door. So I said, aha, now I can emotionally understand the pain of sickle cell disease. So Brandon, how does that feel compared to a sickle cell crisis? He looks at his finger, he looks at me, and he said, Dr. Hofstra, the pain was almost as bad as the pain that brings me to the hospital from my sickle cell disease. So we have to treat these young men and young ladies with sickle cell disease with powerful pain medicines, morphine, Dilaudid, and other powerful pain medicines because of that amount of pain. And if we don't treat them properly, it's like smashing your finger in a car door for a week, because these pain crises last on average 5 to 7 days.
Talk to me about the arc, where the treatment has gone, longevity, how long these kids lived when you first got into this business, how long they're living now.
Yeah, when I first started at Children's Hospital Los Angeles over 20 years ago, oh my goodness, wow, we would have 10 to 15 kids in the hospital any given time with sickle cell pain crises or other complications from their sickle cell disease. Now, with advances in treatment, we now average 2, maybe 3 patients hospitalized at any given time. And a lot of that is because newborn screening has happened. So in the United States, every state in the country in the United States now tests for sickle cell disease, because early intervention, early education of parents and families of children with sickle cell disease improves their outcome. So historically, people were dying before the age of 5, but now with the institution of prophylactic antibiotics, educating families about the signs and symptoms of stroke and other complications. In the United States, 95% of children make it to 18 years of age. But if you go to other areas of the world, like sub-Saharan Africa and parts of the Middle East, 50% of children with sickle cell disease, or even up to 90% in rural areas, die before their 5th birthday. And that's because they don't have organized newborn screening. They've got a lot of trials where they've looked at it and said, yeah, it can happen on a local basis, but on a national basis, it's been very difficult to institute. And so if we could get newborn screening in these emerging nations and start these children on prophylactic penicillin, start them on medicines that help prevent the sickling, we could really make a huge impact.
Pediatric work, I mean, you work with kids all the time, but back in the day when you know, 20 years ago, if I came in with my child, I mean, if you were going to level with me, the chances were they were not going to be adults. As the care improves, as they become adults, adult doctors don't know how to do what you do they? I mean, is that another issue?
That's a huge issue, and it's recognized both nationally and internationally that transition of sickle cell disease from pediatrics to adult providers is fraught with problems because historically, adult hematologists didn't take care of these kids because they were dying. So at Children's Hospital, we actually have developed a transition program that we kind of call non-transition transition, where we work with community physicians and adult hematologists and say, please, you know, there's a lot of internal medicine things that we as pediatricians don't deal with, but we deal with sickle cell. If you will work and partner with us, we can actually make a difference in these young men and young ladies' lives. The highest risk of death in sickle cell disease in the United States is between the ages of 18 and 25. And whether it's just because they're not getting the care that they need, or whether the disease is changing at that time, there's a lot of issues involved, but we need to do that. We need to work and partner with adult physicians to improve the health of our young men and young ladies with sickle cell.
You kind of did broad strokes for us, but I'd like maybe you go a little dig deeper. Internationally, where do you find the disease? And it's not just obviously here in the United States, it's elsewhere. You kind of touched on the fact that in some areas, children live to be 5. They don't have a longevity that perhaps you'll find here in the United States.
In Nigeria alone, 150,000 children are born with sickle cell disease annually in any given year. We have only 80 to 100,000 people in the entire United States of all ages with sickle cell. So in sub-Saharan Africa, 200,000+ children are born every year with sickle cell disease, and over 50% of them are not going to make it to their 5th birthday unless we can start recognizing this disease early, starting these children on penicillin prophylaxis, helping families and clinicians recognize that a fever could be an overwhelming infection and needs to be treated aggressively, showing them how to feel for a spleen, because the spleen is an organ right under your rib cage on the left side, and your entire blood volume can get stuck there when you have sickle cell disease because of that log jamming that happens. And, you know, I care a great deal about kids with sickle cell disease. I want them to grow up to be as healthy as they can be. We are going to have a cure for sickle cell disease in the patients' lifetimes that I'm taking care of right now.
So you've got to create that lifeline.
I want these children to be healthy as long as they can be until the cure is there. And we're starting now. Gene therapy trials are happening right now. Children's Hospital is partnering with UCLA. We did a lot of preclinical work on gene therapy where we gave our patients volunteered bone marrow for people to experiment in the laboratory on how to put in non-sickle genes in sickle bone marrow. And now, because of that devotion that my kids and their families had, we are now able to have a clinical trial to try and do gene therapy for sickle cell disease.
20 years ago, when you were at the starting line, to see the finish line, I mean, you can literally see the finish line. You may not know where it is exactly. What's that like?
Ever since I started doing sickle cell disease, I said, we're going to have gene therapy in 10 years. We're going to have gene therapy in 10 years. We're going to have gene therapy in 10 years. To be able to now at least have the first steps of gene therapy is unbelievably exciting. And I say to my children and their families every day, you need to do what you need to do to stay healthy so you will be cured of this condition.
So what is it for the layman, and why is it so promising?
Right now, gene therapy, for sickle cell disease, it's a single gene, one small error in the DNA in a single gene creates all these problems, the pain crises, the stroke risk, the infection risk. And if we can take a healthy gene and replace the sickle gene or make it so that gene is more effective than the sickle gene, we can make it so those red blood cells stay around and can get through the blood vessels instead of blocking and jamming and causing problems.
So that's that genetic trait. How do you detect it, and how many people are carrying it, and how do you know that your kid has it?
So again, in the United States, all children are tested with newborn screening for hemoglobinopathies, for red cell problems, specifically because of sickle cell disease. So 1 in 12 people of African descent is a carrier of the sickle cell gene, which means that 1 in 400, give or take, is going to have a child with sickle cell disease in the United States. But if you go to parts of Nigeria, as many as 1 in 4 people are carriers or have the sickle cell trait, which means a much higher incidence of children being born with sickle cell disease. 2% of children born in Nigeria have sickle cell disease.
But can this be, you're talking about gene therapy, can it be a tsunami where it just a lot of times we see things here in the United States and it takes forever to get elsewhere in the world.
Yeah. Right now, the only cure for sickle cell disease is bone marrow transplant, and that is prohibitively expensive for many emerging nations and is also difficult to do. Less than 1 in 5 people with sickle cell disease has an appropriately matched donor. So gene therapy, I don't think when we have it fine-tuned will have the same level of cost, but it still is going to be an expensive therapy. And until we can drive down those costs, the best thing that we can do is detect sickle cell early, which is by newborn screening, if possible, and then instituting treatments and education of those patients and families so that they can live good, healthy lives when we can develop cures for everyone.
Stroke one of the biggest concerns?
It certainly is the scariest, and historically, about 1 in 10 children with sickle cell disease would have a stroke where that logjam would happen in a blood vessel to their brain. And we now have testing that helps reduce the chance of a child having a stroke. We measure the blood flow to the brain, and the higher it is, the more likely it is that they'll have a stroke, and that's what we call a transcranial Doppler. By starting those patients on transfusions, we have reduced the chance of a stroke from 1 in 10 to less than 1 in 50. But that means every 3 or every 4 weeks, these children are coming to the hospital, getting a blood transfusion. We don't know how long they need to continue on transfusions, so it's right now indefinitely. And then they have issues related to chronic transfusions. So it's a huge burden to try and reduce stroke risk, but it's worth it because if you stroked, you now have the neurologic problems of a stroke. Plus, if you don't go on the transfusions, you'll stroke again. So preventing a stroke by transfusions is, in my mind, the way to go until we have gene therapy.
For someone who's devoted 20 years, 2 decades of your life to sickle cell disease, it doesn't get as much attention, and I know that has to be frustrating to you. Is it? And how do you deal with that?
Yeah, it is frustrating. I don't like the fact that sickle cell disease does not get the same level of funding as some other inherited genetic diseases. But I still hold out hope because we are making progress. And we've only had 2 things that have happened that have improved the lives of sickle cells so far, and that is newborn screening and hydroxyurea. But there's a lot more on the horizon now. There are a lot of new medicines that people are looking at that will do a different way of preventing the logjam from happening. There's a medicine that actually prevents red cells and white cells from sticking to the side of the blood vessel and causing that. There are clinical trials going on for that right now. There are other medicines that may increase the fetal hemoglobin and decrease sickle hemoglobin. There are lots of things that are happening. So I'm excited. I'm excited. I love my kids. I want my kids to grow up to be healthy. I want them to be healthy when we have the cure, and it is going to happen in their lifetime.
It's a very promising time.
I agree.
It's an exciting time to be a part of all of this, isn't it?
It is.
Yeah. Doctor, thanks so much for coming in and talking to us. Really appreciate it.
I really appreciate you bringing attention to sickle cell disease, and I think this is a really good forum to do that, so thank you.
You bet.